Botox is the #1 aesthetic procedure in the world, and RejuvenationMD is in the top 1% in the country with how much Botox and filler we do here. And we are not a franchise, but we do a lot of it. And we are on both ends of the needle. So we get Botox and we love to give Botox. But I'm going to show you how easy a Botox procedure is, because many people have misconceptions that it's super painful or it takes forever to do, etc., etc. But you can watch right now and see exactly what a typical procedure is like. So today we are going to treat our patient's crow's feet, and that would be the lines on the sides of the eyes, her glabella, that sometimes give these 11s that people know, that people call them, and then her forehead. And these are all FDA cleared areas that Botox is used for. So we're going to start with the crow's feet. So I'm going to have you turn away from me. And the FDA recommends 12 units per side. Smile for me. Great. Relax. And 1, 2, 3, right there. And they used to recommend just 6 units per side, but then people realized that 6 units wasn't lasting the full 3 to 4 months. So a number of years ago, they changed that to just 12 units per side, and that will last you 3 to 4 months. It can take anywhere from 3 to 4 days up to 2 whole weeks for it to work, though. People worry about doing their crow's feet because they think that it's going to take away their expression. But what I say is it only takes away the squinty. It does not take away the happy. So when you smile, your cheeks are still going to give you some lines coming up, but you're not going to have the squinty lines over here. So we're going to start, turn towards me with the glabella. I'm going to just start in the middle. Ready? 1, 2, 3. So there are 3 muscles here. This is called the glabellar complex that cause those 11s. Sometimes people just have a 1. Sorry, make my way around here. There we go. So we have to treat all of those 3 muscles. Just treating one is not going to do the trick. So a lot of times people feel like just treating that one will make this whole area stop moving, but it's not the case. So we're going to just go there, right there. So this, we're going to start over your left eyebrow now, over the corrugator. 1, 2, 3. Perfect. And let's go again here. And the typical dose for the glabella is 20 units. To start, I've done up to 60 or even 80 units, depending on, if you're a man or a woman, if you're really, really strong. Sometimes you need more than that. They're doing studies now on treating people with 100 units to see if it will last for a year. So that will be great once those studies are complete. So her glabella is done, and now I'm going to do her forehead. So we're going to go over your left eyebrow. Here we go. And this will help those forehead lines smooth out. Now, people come to me and they say, I want a brow lift to treat my forehead. And that is not how Botox works. Botox is a paralytic, so it paralyzes. So if we treat the elevator muscle, which is what this is, we're not going to get a brow lift. If we treat the glabella, these are depressor muscles. So if we paralyze the depressors, now the only thing that's active is the elevator, and that is how you get the brow lift. If we treat the forehead without treating the glabella, then you can get, your brow could come down. So a lot of times I won't do that in patients when they have heavy eyelids. But if we treat the glabella and we treat the forehead, then typically people's brows stay typically the same. They stay usually in the same position. So these we're going to paralyze to get a lift. This we're going to paralyze to get, and that gives you a little drop. But when you do them together, it works out perfectly and you don't get a drop or a lift.